My name is Jenna Nikina. I'm a retinal surgeon, and in this series of videos, I'm exploring myths about myopia. So, first of all, what is myopia? We also call it short sight. And if you're short-sighted, you have trouble seeing far away. You usually have a really close focal point, so you can read really close up, but distance is blurry and tricky to see. It's one of the conditions that opticians prescribe glasses for, and you need distance glasses to be able to focus up in the distance. Now, short sight has quite a strong genetic element, so if your parents were very short-sighted, chances are you will be as well. But that doesn't always happen. There are lots and lots of environmental factors which contribute to you being short-sighted, like lots of near work, especially as a child, reading books too close up or using screens close up. And not enough outdoor time because the outdoor light and the outdoor environment is shown to be protective against developing short sight. And good lighting as well, especially when you're doing near tasks, is protective against becoming more myopic. Now, so what's the first myth about being short-sighted? Well, what people often think is that wearing glasses will make it get worse. And we hear this a lot. And this is very much not true. So what happens is when you're young, especially in a child, the eyes are able to compensate for part of their refractive error, so for part of the focusing difficulty, by squeezing the muscles inside them really hard to try to focus a little extra bit. And then when we wear glasses, sometimes in a child, that those muscles will gradually relax and get used to the glasses. And so it might seem that the myopia is changing or the glasses prescription is changing. So that's one reason people think that glasses can affect it. But also, myopia naturally progresses. It's something that naturally tends to slowly get worse, not indefinitely. Usually, the progression is over the childhood and the teen years, maybe into the early 20s. And after that, in most people, it tends to stabilize and not change anymore. But in that initial period, when it begins to change, you might think, well, I've put glasses on and now I'm getting worse. But actually, that's just the eye's natural progression through time. So if you do need to wear glasses, please do. It's really important because it'll avoid eye strain, it'll avoid headaches for you, and it has no impact on the myopia getting worse. It doesn't affect the eyes in a deleterious manner. What's the second myth about myopia? Well, the other thing we hear quite a lot is that you can't do activities that involve straining. So, for example, lifting heavy things, or that your retina can fall off if you cough. Sometimes women are advised not to undergo natural childbirth because of the straining involved, because somehow this will affect their short sight, and this is quite prevalent. And these are actually also very much not true. Where do these beliefs come from? Well, decades ago, people thought kind of, well, if you strain, if you put pressure on, then perhaps it can make your retina fall off. We do know now that the mechanisms of retinal detachment and other risk factors associated with myopia, they don't actually have anything to do with straining. When you strain, like if you cough or sneeze or lift something heavy, you do temporarily put your blood pressure up and you put some internal pressure on the organs in your body. And because of that, you are at higher incidence of bleeds at that point in time. And you can have a bleed in your eye. Yes, this is true. It is not a common effect. And it usually happens if you have a weak little blood vessel somewhere. We see these bleeds inside the eye from time to time. The good news is if you have a bleed from straining inside the eye, it may affect your vision. Your vision may be blurry, but actually it gets better by itself the vast majority of the time, just with time, in a few days or weeks. But lifting and coughing and straining and putting pressure on in a so-called Valsalva maneuver, as we doctors call it, that doesn't cause any risk, any increased risk to a retinal detachment, retinal tears, or other problems with your retina where the retina comes away. What can affect the retina in terms of promoting retinal detachment are activities with a rapid acceleration deceleration. So things like roller coasters, or obviously injury to the eye, where you have an impact to the eye itself. Because what that does is it causes the jelly inside the eye to shake around, to move forward and backwards rapidly. And it's that movement of the jelly which tugs on the retina and can sometimes cause retinal tears. And retinal tears are the culprit for retinal detachment the majority of the time. Doesn't mean that if you're short-sighted, you can't do roller coasters. The risk is still very small, but it's just something to be borne in mind. And perhaps if you have a history of retinal detachment or retinal tears, perhaps be a little bit more circumspect about undertaking these activities. And certainly sports such as boxing, where direct impacts to the eye are quite likely, you need to be careful with those if you have either a strong family history of retinal detachment or a personal history of it.